Hello, everybody. Welcome to Chapter 6 Working with Others Teamwork, Supervision, and Delegation. In this chapter, we are discussing about our role as a personal support worker, as a member of the team. Actually, we are working in the team, the whole nursing team, and our role as a team member is very crucial. It is being wider and wider every day. We work under the supervision of nurse and nursing supervisors, and we may have to work under their supervision. That's called delegation of the work by the nurses. Let's begin from the healthcare team. What is a healthcare team and who are the members of the healthcare team? Healthcare team members support each other. They have a feelings of helping each other. They have a goal of clients' positive health outcome, and we are working as a team member supporting each other. We understand each other's scope of practice and communicate with each other very effectively. Here, the effective communication means we communicate in the team member in a professional manner. In the previous chapter, we discussed about the professional way of communicating among and between the team members and therapeutic communication with the client. The goal of the healthcare team, there is a certain goal is designed within the healthcare team. The goal is to provide client with the best possible. See here, the terminology we have to understand. To provide client with the best possible care and support. We are always stretching our hand for the betterment, for the wellness of the client. Health team members must all conduct themselves professionally at all times because if healthcare workers work in a professional way, then only the best possible care, possible support we can provide to our clients in the different setting. Team members vary depending upon the place of the employment. If we are working in the facility, we have a group of team, we working together face to face. But if we work in the community setting, in the client's home, we are alone working there. Still, we have to connect the family member, we have to be connected with the client, and we have to be connected with the agency we work. So we are just playing significant role and we are the connecting agent. We document, we transfer the observation through the documentation. We are still connected with the nurses as a team member. And there are so many benefits of working as a team. Be mindful that this is a teamwork. Nursing is a teamwork, and everybody has a different responsibility to perform for the better health outcome of our clients. The first benefit could be opportunities for the collaboration. We work in collaboration. We work in the team. And in collaboration, what happens? We are helping each other and we are working in a coordination. We share the responsibility as our job description, as our scope of practice. We work in a collaboration, but at the same time, our individual responsibilities are still there. We have to fulfill our individual assignments. And again, same time, we have to work in the collaboration with other people. Number 2 point says the opportunities for communication. The most effective way of making collaboration, working in collaboration, to collaborate among and between the team members is the communication. We have to be open in communication, clear in communication, precise in communication, concise in communication. We have to be very much accurate in communication because Communication also represents in our documentation. Documentation means what we care, we have to write them in a place. That's a documentation. And this documentation helps us as a better mode of communication among the team members. Again, the next point could be the opportunities for mentorship. Mentorship, there are certain mentors, the nurse managers and the RNs or registered practical nurses. They could be the mentor. They are helping us. We are asking them different questions. There is a teaching process going on among the team members because we are always asking something, we are always trying to clarify the things we are not aware of. That's how the mentorship. The mentor helps a lot of activities to be performed in the different setting for us. And we are the PSW, we are always working under the guidance, under the mentorship of nurses. A wide array of abilities. There are a lot of, the list of the abilities. There are a lot of skills and perspectives. There are so many ways of seeing the things in a different ways. There are perspectives. And all these things are possible only when we have a effective team, active team led by the nurses. Better decision making and problem solving. Remember, more than one mind is better than just one mind. When many healthcare team members, they sit together, they discuss about the issues related with the client care, and they come to the conclusion which is always better than a single person's decision. And because of the teamwork, we always learn to be positive. We start trusting, we establish the trusting atmosphere between the team members. Trusting, after we learn how to develop the trusting atmosphere, we build the trusting atmosphere in the client's home, in the facility, in the community, with the family members, with the senior members of the healthcare team, and other co-workers. That's why there are so many benefits of working on a team. Again, at the same time, beside the benefits, there are certain challenges in working on the team as well. Recognizing the role boundaries. We have to know what are our roles to be performed. Again, this reminds us our scope of practice. What are the areas of work we are supposed to perform, we are supposed to do? What are the things we are not supposed to do? We have to know what we are supposed to do and what we are not supposed to do at the same time. Never attempt any task you are not allowed to perform. See, this is what is the nursing goes. Do not do anything which you do not know. That's why never attempt any task you are not allowed to do. You are personal support worker. Do not try to do the catheterization. Do not try to give the injection to the client. Even you are not allowed to give the medication in certain situation. Maybe certain situation you may be allowed as UCP under the supervision of the nurses, but most of the time you are not certified to give medication, to administer medication. That's why we have to know what is our boundaries, what are the scope of practice we have to follow, and what are the things we cannot do at all. Being flexible. Flexibility goes with your work availability, how much you can work, or you can discuss with the employer. And while providing the care also, we have to be very much flexible. The reason of flexibility is if we go to a client and we communicate with the client, but the client for some reason refuses the care at that point, then what do? You have to provide the care again. Even if the client refuses, you have to give another second try, third try. Even you have to ask with your supervisor how many times you have to go and ask for providing the care you have to do. That's it. That's the way of being flexible with the client while working as a PSW. Handling conflict. We may be handling certain conflict in the workplace environment. The way it is handled affects the entire team. If we are very cool and calm, if we are positively handling the situation, if we are not using the blaming language to other, if we are being very open to the communication, open to the new learning, we are building a positive, we are building the effective team. If we are not following those positivities, those professionalism, our team becomes very ineffective and we cannot work effectively as a team member. These are the challenges in the working. So sometimes the people may have the habit of showing attitude, showing anger with other people. They use rough language to other team members. That makes the team very weak, and effective activities, the goal oriented activities, the positive and safe care will be impaired. That's why we have to be very careful while handling the conflict. We have to be very open with our team members. Similarly, expressing your needs and views, you may have always the chances to express yourself, what you are thinking about that decision. Many decisions are being made in the team, and you can always have your chances to express your opinions, your needs, and your views. It is always respected. So, when it is all about the providing better care for the client, when it is not your personal life events and all other thing, when your discussion goes under the team discussion, as a part of the team discussing your views, your news, your needs, your ideas, your opinion are always valued. Not being intimidated by the physicians and nurses. Sometimes you may be intimidated by the nurses or the physician. Sometimes in that cases you are still having the chances to talk with your nursing managers. Your nurse managers are there, but sometimes many things happen. We are not we cannot control those unexpected events. Sometimes there may be the conflict with the nurses, conflict with the co-workers, sometimes maybe conflict with the client, but we have to expect everything. But the best idea is we have to be positive in handling those conflicts, and we always have the opportunity to express our views and ideas. Teamwork in the facility. When we are working in the facilities, mean in the hospital, long-term care homes, or nursing homes, these are the facilities. And how we work in the facilities, it means team may consist of the nurses and support workers only. Maybe there are some physiotherapists, the doctors, the physician, occupational therapists, but basically in the facilities, in the long-term care facilities, for example, the team may consist of the nurse and the support worker. Some other people of the housekeeping may be there. Hospital team vary from unit to unit, and many use a multidisciplinary team approach. In a team, there are so many people working together: physiotherapy, occupational therapies, the surgeon, the doctors, and family members, and other social service worker, and so many other people are there. It is called multidisciplinary team, and we are the integral part of that team, and we may have to work in that situation. Interdisciplinary team includes the healthcare provider from a variety of backgrounds and the specialties. So who are the members in the interdisciplinary team? In the interdisciplinary team, doctors, physicians, surgeons, occupational therapists, physiotherapists, psychologists, psychiatrists, related to the mental health issues, and all other doctors, nurses, and the PSWs are there in the interdisciplinary team. And we have to work in those with the team in the facilities. Teamwork in the facilities continues. Long-term care teams often include a physician, nurse. See here, long-term care homes, they have a team members who are the physicians, nurses, support workers, therapists, they are physiotherapists, occupational therapists, the client, and the client's family. These are the usually the member of the team, because we include the client's family also in the care plan, how to provide the better care for the client. Family member have also a very significant role there to play. Hospice and palliative care. Hospice and palliative, these are the end life care. These are the chronic disease and end stage of care of the person, may consist of the nurses, support worker, physician, social worker, physician, social service worker, volunteers may be there, dietitian are working there, the client is also there, and the client's family. See, there are so many people in the team, and we have to protect our professionalism. We have to maintain our professionalism as a member of this bigger team. Long-term care facilities, but are also considered community-based services. And no matter it is the facility-based work, but it is also considered community-based because it is working directly with the community as well. So many people are coming from the community to the long-term care homes. At the same time, so many people are going back to the community from the long-term care homes as well. So these are also considered community-based because the people of the community, they are changing themselves here and there, and it is also called the community based. And outreach program, there are different outreach program in connection to the community and the long-term care homes. We are also working in those areas. Teams in the facilities. Family conference. The family members are called for the conferences by the doctors and the team of the nurses and the PSW. We are also working with there. It is called care conference. So basically, the main idea of family conference is the loved one of their family is placed in the long-term care home, and the service provider, the physician, the nurses want to ask, want to verify, want to clarify what kind of care they want to their loved ones who are living in the long-term care facility. And the care conference, family conference, it allows the family members to share their views, to share their opinions, to share their ideas, to support them financially, and to discuss about the model of the treatment and the further treatment process and procedures. A meeting attended by the healthcare team and family members to discuss the client's care and to ask the questions, expressing feelings, and make the decision. There is a power of attorney also take part in the care conference. The power of attorney makes the final decision what kind of care they intend to provide their loved ones as a family member. This is very significant care conference, and we PSW, we are the part of that conference. We have a chance to express our feelings, our thoughts, how we can provide them better health, for the better health outcome, for the better care. We can share our ideas in those care conference as well. Now, the second type of facility is assisted living facility. In the number of staffs are usually small. Team members involved depends on the needs of the client. Who are the team members? Maybe there are some nurses or doctors visit weekly basis. Team usually include the supervisor, is a nursing supervisor, means the nurse, and one or two support workers. They are working in the assisted living facility, because the number of the people living in the assisted facility as a client, they are relatively few in number. Teamwork in the community setting. Community setting means we are working in the client's house, and we are working through the agencies, and how we coordinate our work through the agency, family member, client, and we as the PSW. Home care. Case manager from the agency will come and discuss about that, or the team leader, who is usually a nurse, a social service worker, or other regulated healthcare professional. They come, and case manager comes to the family house, in the client's house, and determines how many hours the client need support from outside sources, and how the government can help the family members, help the client in financially, or how the family member can play the role, financial role, and different other roles, and how we can include the family member in the care plan of the client. So family members role, maybe you might be thinking family members are not very important in providing the care, but in nursing, in the community care setting, family members, the agency means the healthcare agency, and the role of the nurses and the social worker, case manager, who is determining all the necessary thing for quality, providing the quality care. All these people are working together. Basically, this is another form of team. Community day programs. There are also certain programs for the rehab people and people who are relatively independent. Rehabilitation program team. When people come from the surgical activities, they need to learn so many things. And rehab center, where there is a different teaching is going on, teaching for different physical issues, to bring back them to the normal life. And a recreational team. There are recreational team in the community day program. The whole day people go to the community setting, and they learn so many new ideas, new learnings there. Like for the diabetes people, they discuss about what are the dietary changes a diabetic person has to follow, and all those things. And recreational, there are different games and singing, dancing taking place for making our client happy every day in those community day programs. Similarly, we are working under the supervision of the nurses. Remember, always we are working under the supervision of the nurses. They are called supervisor, they are called nurse manager, and so on. Support workers are responsible to their supervisor, their clients, and their co-workers. Accountable to supervisor may be RN, registered nurse, or PN, practical nurse. Maybe, or it is also called RPN, registered practical nurse. Other names of the supervisor include the team leader, charge nurse, nurse in charge. It is also called charge nurse or nurse in charge, or the case manager. Remember, case manager is also a nurse. Basically, a case manager is not doing the bedside nursing, not giving personal care, but determining the need of the client and connecting the client with other different external resources to provide better care. The client and the family can also be your supervisor. See here, the client who is capable of making his or her own decision of medical conditions, medical procedure, treatment process. The client or the family who are capable of making decision, they can be your supervisor in a private contract. In that situation, you are directly hired by the family or the client. Assigning and delegation. Who are assigning the work to whom? What is meant by delegation? These are two beautiful terminology we need to understand. Assigning means appointing someone to take on a task or a responsibility that is within his or her scope of practice. Assigning. This is called assignment. This is the responsibility. I want to give an example of the assignment. You are working in the long-term care home, third floor, for example, and there are different team nursing, and you are working in the team A. In the team A, you are preparing, you are providing quality, empathetic, culturally appropriate care for 10 clients, 10 residents, let's say. So that's called assigning. You are appointed by the nurses and you have to perform your responsibility there, that is within your scope of practice. And the task, a function, procedure, activity that you assist the client with or perform the client. This is like morning care, giving client warm, giving client some comfort, giving some massage to the client as mentioned in the care plan, or helping the client in the activities of daily living. For example of your work could be activities of daily living means you are providing morning care, helping the client in dress up, you are giving oral care, you are transferring the client from bed to the wheelchair, and you are bringing the client in the dining room, you are feeding the client, or you are encouraging the client, or you are assisting the client in feeding as per needed. And the instrumental activities. These instrumental activities are instrumental activities of daily livings. These are in the community setting. You are cleaning the clothes, you are doing some laundry, you are sometime going for the grocery for the client, you may be sometime paying the bills of the client, but be careful. Your handling of client's property or client's money could be very dangerous. If you misuse that, you will have to face the criminal charges. It is called financial abuse, and it is very, very dangerous to handle the client's money and monetary stuff. We have to always be careful. Social and recreational activities. We may be taking the client in the TV room, or we may be taking the client in the outside in the ground, and different recreational activities. We can work with those clients. Household management, again, in the household management, you are going to the client's room, cleaning the bed, changing the linens, and cleaning the floor, sanitizing the things, and making the things in the proper place. These are household management, both in the facility or in the community. And basic support care tasks. You are supporting the client in the washroom. You are supporting the client to put the briefs or pull-ups for the dress up and all other things. So these are just the assignment, and it is also called assigning. You are assigned by the nurses, the supervisor, to do all these different type of works. And the delegation. Delegation is another name for the delegation. This is a transfer of function. Somebody is there who transfer that person's work to you. But there are so many conditions in the delegation, remember. It is a controlled act. Delegation is a controlled act. A nurse can delegate certain activities, not the all. Nurse practice acts gives RNs and RPNs certain responsibility and the authority to perform nursing tasks. Nurse practice acts give these nurses certain authority to practice certain nursing tasks, to perform certain nursing tasks. The delegation nurse remains accountable for the delegated task. The delegating nurse. The nurse delegated you to feed the client who has a difficulty swallowing. Again, the client has a difficulty swallowing and client even choking there. The delegating nurse remains accountable. She is accountable of the delegated task. So the difficulties and the issues related with that swallowing problem and the choking of the food, the nurse is accountable for that because she delegated you her task. And she can delegate certain tasks like feeding or transferring the client from bed to the wheelchair or wheelchair to the bed. It can be delegated, not other specific nursing tasks. Support workers are not allowed to delegate tasks, remember, but nurses can delegate us some tasks, but we, support workers, are not allowed to delegate the task. There is a big question, why? Why we cannot delegate the task to other PSW? We are the PSW and our co-workers, other PSW, we cannot delegate. Because who can delegate? The Nurse Practice Act. Because we are not the nurses, we are just the PSW, and the delegation allows only for the RNs and LPN or RPNs. Only these people can delegate because they are working under the supervision of the colleges, like Colleges of Nurses of Ontario. In Ontario, all the RNs and RPNs, they work under that college, and therefore they are accountable to their license. They are accountable to those activities delegated tasks, but we cannot delegate. So to summarize, PSW, they can receive the delegation from the nurses, they can do the assignment, but they cannot delegate their work to other PSW. That's it. Now, delegation in the facility, how people delegate in the facility. Let's talk about it. When RNs delegate a task, they must be confident that the support worker can perform that task. The person who delegates must know that the support worker has that knowledge, skill, and judgment to perform that task. The support worker who understands what the responsibilities are when performing the task. See, number one condition. The RN, registered nurse, they delegate certain tasks to the PSW, and they must know that the PSW understand what the responsibility and when performing the task. And the PSW knows when and whom to ask for assistance. Because during the work, PSW may have difficulty in understanding. She might need to clarify something, so she must have somebody to clarify for the assistance. Knows when, how, and to whom to report the outcome of the task. The PSW must have this opportunity to report when to report, how to report, or whom to report the outcome of the task. What was the outcome of the task? For example, was the client able to eat the lunch, or the client was not able to take lunch or drink any fluid, or so on. Your employer's policies and guidelines, your job description, your provincial and territorial legislation determines what task can be delegated to you by the nurses. The employer's policies, the provincial and territorial legislation, it is all the legal things. Legislation determine what tasks can be delegated to you, not all the tasks. You cannot go and give the medication. You cannot go and give the injection. You cannot go and give the perform like procedure like catheterization. You cannot do that, and nobody will delegate those works to you. So the person who delegates must be supervising, must know that you can be able to perform those tasks. You have that education. You are qualified for the task. You have the skill, knowledge, and judgment for the tasks. You know the outcome of those tasks. The outcome may be of two types. One could be negative outcome, one could be positive outcome. If the negative outcome is there, what do you do? If the positive outcome is there, what do you do? You have to know of the both aisles. You have to know the rationale behind what you are doing. And then only RNs or RPN can delegate certain tasks to you. But you cannot delegate your tasks to another, your co-worker, another personal support worker. The delegation process. See, this is the delegation process. The delegated tasks are not transferable to other clients. The nurse came and delegated some tasks to you, and again you transfer the delegated tasks to another person. No, this is big no. You cannot do it. Each situation is unique. Remember, everybody is unique. Each situation is unique. Every day is a new day. Every moment is a new moment in healthcare field, because we have to follow the precaution everywhere. We go, we meet, we talk, we show up, we express views, we express ideas. We have to maintain that. Guidelines for delegation acts vary, so you must know the laws of the province or territory in which you are working. If somebody tries to delegate you that is beyond your scope of practice, you can reject that. You can say that my provincial or territorial laws does not allow me to perform that task. Can you double check? Would you mind double check with that? You can tell that. You don't reject the work like in a jerking way. You can tell them in a polite language, my provincial and territorial legislation does not or do not allow me to perform these tasks. This is how very, very nicely, in a professional way, communicate. Factor affecting delegation decision for the nurses. Please go to page number 95 and see how the factor affecting the delegation decision for the nurses is mentioned there. So when we are given certain tasks, when somebody delegates, the decision of delegation is made, we have to know that the factors affecting the delegation decision for the nurses to make it is appropriate that a support worker performs these tasks considering the client's condition, associated risks, and environmental supports. The person who delegates the tasks should know it. The nurse must know this. If these tasks will be performed in a safe way, in that environmental way, if the task is not contraindicating to the client's condition, and all related things the nurse must know. Will the support worker be performing the tasks frequently enough to maintain the competencies? The nurse has to know this idea before he or she delegates the work to you. Can the support worker be adequately supervised in the setting? When the person delegates the tasks, you must be supervised by that person. The person cannot delegate tasks and you cannot work alone without being supervised. Is a nurse available to help if the client's condition changes or problems arises? You have to make sure that before you accepting the delegation, you have to make sure that in the adverse situation, is the nurse available to help if something goes wrong? You have to make sure it. Is this a task that can be delegated to a support worker, and is it included in her job description? This is the nurse's responsibility. The nurse has to determine, is it good to give this task to the nurse or to the support worker or not. This is her responsibility. Let's go to the delegation in the community. In the community nursing, when we working in the client's home, like home to home type of nursing in the community, what kind of delegation is there? Same process as in the facility. There are delegation in the two setting. One in the facility means long-term care home and hospital, and another delegation in the community. But the process of delegation, the scope of practice, the supervision, the determination of the support workers' ability to perform the tasks, the level of education, it is also called the skill, judgment, and ability to perform the tasks in the typical time frame. It is determined by the nurses. Some agencies have educational program or workshop for the support worker because they know that they have to delegate certain tasks to the support worker. Before they delegate the tasks to the support worker, they have educational programs for the support worker. This is a special program like how to work in the setting, how to work with the client diagnosed with the dementia or Alzheimer's disease. There are so many trainings program these agencies, healthcare agencies are organizing. Never perform a task that is beyond your scope of practice. That is the most important thing in this area. Never perform any task that is beyond your scope of practice. As I already said you can very nicely, you can say, my provincial or territorial legislation does not allow me to do this task. You clearly give your idea and do not do the task if it is not your scope of practice. If asked to do by a client, explain that you are not allowed to perform the task without permission from your nurse supervisor. Even the client says, give my injection here. Do you give injection to the client? No, never. Even never imagine of that, giving injection to the client as a personal support worker. But the best way to prevent this mistake is very nicely, in a quite very clear way, tell the client that you are not allowed to perform this task without permission. Even the nurse supervisor gives you permission, do not give the injection. And definitely, for sure, no nurse will allow you to give the permission to give the injection. Similarly, there are 5 rights of delegation. We have to be mindful of these 5 rights. The RN or the supervisor must review the right task, if the delegated task is right for the PSW or not. They have to determine right circumstances. In what circumstances? Remember, this circumstances is very important word in healthcare setting. In which circumstances you perform that task? In which circumstances you did not perform the task? It is counted. Right person, is the delegation given to that particular person, the PSW, is the person is okay? Is the person has the knowledge? Is the person has a skill, judgment, ability to perform, ability to provide the safe care or not? It is the RN's or the supervisor's decision. Right direction and communication. Is the direction, is the task delegated, is straightforward task or not? Or is the communication clearly communicated or not? There should be no confusion at all. That's why the right direction should be given by the RNs or the supervisors, or the communication should be straightforward. Right supervision and evaluation. When the task is delegated, is there supervision or not? Is there evaluation or not? If the nurse is not there to supervise, to see the delegated task when you are doing, you cannot do that task because you are not allowed to do the task without supervision. Do not be offended or feel angry if you are not allowed to perform a task that you usually do. Sometimes some tasks you have been doing since long and it came to attention that you were doing the tasks you were not allowed to do. At that time, you don't feel angry or don't feel offended or angry for that task because it all goes with the legislative and the bodies of the health team who decide what task is good for delegation or not. Your role in delegation. What is the role you play in the delegation? Although the nurse is responsible for teaching you, supervising you, and monitoring during the task performing period, the nurse will monitor your performance. You are responsible for your own action. Even if you are working under the nurse's supervision, you are accountable. You are responsible. You have to answer. If you if you neglect your work, you are responsible for that. And you are charged for that. Definitely you will be charged. Two choices: to agree or refuse to the task. You have always two choices. Either you agree to perform the task. If you agree, you have to do it very honestly. If you refuse, you can refuse in certain situation. Review the factors affecting delegation decision in page number 97. There are certain points. You just turn the pages, go 97 page and review that. These are the same points we discuss here. You have the right to say no. Yes, you have the right to say no. Because when concerned about your ability to the task, you know that you cannot perform that task. Do you do the task? No. Say, I cannot perform the task because I do not have that ability. I do not have that education. I do not have the skill to perform the task. If you say it very professional way, they will understand you. When the task is beyond your scope of practice, again the same thing repeated. You can remind the nurses that your legislative bodies, your provincial or territorial legislation, they do not allow you to perform those tasks and it doesn't belong to your scope of practice. Just clearly tell them. When the client's condition has changed, remember, when the client's condition has changed, in the adverse situation, certain tasks you cannot do, or you can say, no, I cannot do it because of the client's condition. It is very life-threatening. I cannot do it. You can say. You have a right to say that. Because when the client's condition changes, when the client has the adverse life-threatening condition, the nurses have to look after the client. They have to call the doctor or call the 911 and send the client to the hospital in the emergency. That's why you can say no. Responsibilities. As a support worker, definitely we have so many responsibilities. In the delegation, in the assignment, we have the responsibilities. Our responsibilities, our fulfilling the responsibility that makes us a professional. Use common sense. Remember, as a support worker, the maximum time we have to use the common sense. Do not ignore an order or request. If your client asks you something, do not ignore that or do not ignore the request. If your nurse supervisor tells you something, do not say, no, I cannot do it. For the user, you can use your common sense for this. You must communicate your concern to the nurse. If you feel uneasy of something, you can communicate very clearly. You must have a sound reason for your refusal. You can refuse the task. Definitely, you can refuse the task, but you must have a sound reason. You must give your reason. They will ask you, why are you refusing the task? They will ask you, and you have to give the reason for that. Because you do not like or want to complete the task is not a sound reason. You are not doing the work because you don't like to do it. That's not a good logic. That's not a good rationale you can give. There must be sound reason. What you do or do not do can harm a client. Remember, what you do, if you do something without knowing how to do, it can harm the client. If you do not do something you have to do, again, it will harm the client. So both the aisles, you have to be careful. What you do or do not do, it can harm the client. We have to be careful about that. Thank you. Thank you for your cooperation, and thank you for your patience to listening the lecture. Please go to your textbook and the lecture together, and you will have a good understanding. Thank you. Have a good day.